Hello, I'm Sang-Ho Lee from the Kyung-hee University Hospital at Gangdong. Today, I will talk about the waiting list management and rules of allocation principles of transplant waiting list in Korea. Let me start by briefly describing the current status of organ transplantation in Korea. In 2022, the total number of organ transplants performed in Korea was 5,508. Unfortunately, the overall number of transplants has been declining slightly in recent years, and more importantly, the number of brain death transplants in blue continues to decline after peaking in 2016. This has led to an increase in living donor transplants. This table shows the number of transplants by organ type. Kidney and liver are the most common transplants performed. The problem is that there is a shortage of brain death donors, with more than twice as many living donor transplants for kidneys and 3 times as many for liver. In 2022, a total of 405 brain death donors were identified, of which 258 were men, with men outnumbering women, and the largest number of donors were in the 50-64 age group. In the meantime, the number of people waiting for brain death organs has grown significantly. Kidneys in particular have nearly doubled in a decade, and the wait for other organs is steadily increasing. As a result, the waiting time for transplants is also increasing, and in the case of kidneys, brain death transplant recipients in 2022 waited an average of 6.8 years to receive a transplant. The registration system for transplant recipients of organs from brain-dead donors involves several critical steps to ensure that organs are allocated efficiently and fairly. Here's a breakdown of how the system typically works. This enrollment system consists of 5 elements: eligibility assessment, registration on the waiting list, prioritization and matching process, notification and organ offer, and continual update and maintenance. This system strives to be as efficient and fair as possible, using established medical criteria and ethical guidelines to govern the process of organ allocation. Different countries may have variations in how these steps are implemented based on their healthcare policies, technological capabilities, and legal frameworks. Before being placed on a waiting list, potential recipients undergo a thorough medical evaluation to determine their suitability for transplantation. This assessment includes medical history, current health status, and the severity of their condition. The purpose of this course is to extend the lives of organ transplant recipients and improve their practical quality of life. Once deemed eligible, patients are registered on the transplant waiting list. This list is managed through a centralized database that holds information on all patients waiting for organ transplants. The data recorded includes: first, patient details. They are personal information, blood type, and other relevant health data. Second is medical urgency. It is a priority based on how urgently they need the transplant, which affects their position on the list. Third is tissue compatibility. It is the information on tissue type to ensure the best match with potential donors. Final is blood collection for storage for cross-matching. The prioritization of patients on the waiting list is typically based on medical need, the likelihood of success of the transplant, and the time spent on the waiting list. This system uses a points-based or scoring system to rank patients according to these criteria. When a brain death donor's organs become available, a matching process is initiated to find the most suitable recipient based on: first, tissue and blood type compatibility to minimize the risk of rejection. Second is geographic proximity to reduce the time organs spend in transit. Third is urgency and survival benefit. Higher priority might be given to those who urgently need the transplant and have a high probability of long-term survival post-transplant. When a match is identified, the transplant center is notified from KONOS. The transplant coordinator at the center then contacts the potential recipient to inform them about the available organ. The recipient must quickly decide whether to accept or decline the organ based on their current health status and other personal considerations. The waiting list is continually updated. New patients are added, others are removed if they receive a transplant, and some may be removed if they become too ill to undergo surgery or pass away. This ensures that the list remains accurate and reflects the current needs and statuses of all patients. In Korea, the organization responsible for registering brain death transplant candidates and managing allocations when an actual donor is identified is KONOS, which is under the Ministry of Health and Welfare. KONOS does not operate alone. It collaborates with various related institutions across the country, including organ transplant candidate registration hospitals, 36 HOPOs, and KODA, which is one OPO in Korea. KONOS's primary role is to select transplant recipients objectively and fairly through a system known as KNet, an organ transplantation information system, ensuring that all patients in need of an organ transplant have an equitable opportunity to receive transplant organ. To receive a brain death organ transplant, patients must first consult with medical staff and social workers, including doctors and nurses, at the hospital where they are being treated, and then apply to be registered as a candidate waiting list for a brain death organ transplant, which means they will be registered in the Organ Transplant Information System, named KNet. KNet is a computer program of the National Organ Tissue and Blood Management Institute, KONOS, of the Ministry of Health and Welfare. This is KONOS's KNet, where you enter waitlist information. First, connect and bring up the Manage Transplant window to begin registration. The information you enter is basic information and organ-specific details. The basic information is the patient's name, ID, blood type, height, weight, contact information, transplant registry, and so on. The following are the checklist inputs. There are common inputs and specific inputs for each transplant organ. You'll need to enter slightly different information for kidneys, liver, heart, lungs. First, select the patient by bringing up the Manage Transplant Waitlist and Test Results window in KNet. Then, search for the patient, select the transplant registered organ, and enter the detailed test results. Some transplants require regular specimen management. Specimen management organizations are HOPO, OPO, and targeted patients are kidney and pancreas transplant candidates. The specimen collection schedule is every year, and the purpose is to quickly and accurately perform cross-compatibility testing with the donor in the event of a brain death donor. If you are registered as a kidney and pancreas transplant recipient and your specimen is not collected for up to 3 months from the date of registration or the date of specimen disposal, your waiting time for organ transplantation will not be counted. Korea has a system whereby any potential brain death donor is required by law to be reported. In the case of a brain death donor from HOPO Hospital, an organization that specializes in managing brain death patients, HOPO's own coordinator performs this process. When a brain death donor occurs in a non-HOPO hospitals, a coordinator from KODA, an organ procurement organization, is dispatched to begin brain death management. Management begins with a series of procedures, including physical examination, required tests including blood type and HLA typing, brain death investigation, and brain death determination, which are entered into KONOS's Organ Transplant Information System, KNet. The following is a flowchart of organ donation and transplantation in the event of brain death. The hospital where the brain death occurs is notified of the presumed brain death, and the HOPO or KODA that is notified conducts a physical examination and decides whether to register the patient as a transplant donor. KONOS registers the potential brain donor and oversees the subsequent process. The presumptively brain death donor is managed by HOPO or KODA, where a brain death investigation is conducted and the Brain Death Determination Committee determines brain death. KONOS performs allocation by comparing the details of the registered transplant waiting lists and brain death donor, and then KONOS notifies to the hospitals where the selected transplant candidates are registered. The notified transplant center admits the selected candidates and administers immunosuppressive drugs for transplantation. Transplant staff at the transplant hospital or staff at the HOPO will conduct organ procurement, and the recipient hospital receives the organ and performs the transplantation. Transplant selection for brain death waiting lists will be made using the following allocation points when one brain death patient occurs in each region. Korea is organized into 3 regions for convenience. In cases of kidney and pancreas, the degree of HLA matching is important, and additional points are added according to the patient's age and waiting time. In addition, cross-matching positives, previous transplant history, and previous organ donation history could be added to the score. The concept of extended criteria. Donor kidney is also important in kidney transplantation. KDPI score is an indicator of brain death kidney quality, with a score of 70 or higher indicating a poor prognosis. However, if the recipients are over 40 years old and have a waiting time of 7 years or less, these kidneys can be transplanted with the patient's consent. Patients on waiting lists who meet these criteria are now eligible for a kidney transplant from an expanded criteria donor, KKDPI more than 70%. This is because these patients are more likely to benefit from an expanded criteria donor kidney transplant than just continuing dialysis. The selection of transplant patients on the liver transplant list is more complex. The urgency of the patient's clinical indicators is paramount, and the MELD score, a measure of systemic condition, is also important. The selection principles are that the patient should be a good size to possible organ donor, and the priority is given to urgency. Geography is considered when there are more than 2 patients in the same urgency level. In summary, despite the challenges posed by the declining number of brain death donors, systems like KNOS-KNET and strict adherence to allocation rules help us manage the organ donation process more effectively. By continuing to refine these systems and guidelines, we aim to improve the outcomes for patients awaiting transplants.